Good evening. I'm Dr. Dimitrios Kostopoulos, and this is Hands On News. And today we are with top orthopedic surgeon Dr. Kevin Plancher from Plancher Orthopedics. Good evening, Dr. Plancher.
Good evening. How are you?
I'm doing good, and you are the founder of Plancher Orthopedics.
I am.
For how many years has this organization been around?
Well, we started a private practice group all the way back in 1997 after leaving full-time faculty at Albert Einstein College of Medicine.
All right.
But I still am affiliated with Albert Einstein College of Medicine. It's great always to teach, and we teach still in this practice postgraduate training fellows.
Not only that, but you have your own conference that you are presenting once a year.
Well, our practice is really excited about education. And I think not only do we educate our patients, but I think we have a responsibility as physicians to share ideas. And so once a year we get together in Las Vegas. It sounds kind of silly, but it's a great forum where people can meet from the West Coast and the East Coast. Awesome. And we do a 3-day intensive course where they start at 6 in the morning and we go till 6 at night. So it's definitely a very hard day, and we try to get the best ideas together so that we all can treat our patients with the newest modalities to get them back into whatever that is they want to do.
That's fantastic. And now, summertime, people get to work out more, do more outdoor activities, and I'm sure that you get to see more of the type of injuries that are related to the summer sports activities that people do.
So a lot of our sports injuries relate to seasonal. We have obviously winter sports, summer sports, and in the summer it's going to relate more towards the outdoor, obviously, sports, although some of our hockey players insist on playing inside all year round. So running, as the spring progresses into the summer, brings everyone out because it's a time to just be outdoors. And so we see a large number of ankle injuries, unfortunately, and people that haven't really stretched and really found those muscles so that they can start to do activities. Tennis is a very popular sport, and so unfortunately we get a lot of wrist and elbow. And then the kids love soccer from the camps, and so I get some anterior cruciate ligament, or there's a ligament inside the knee that we get injuries. And I would think basketball and the contact sports, in the early part of the summer, people get banged up. We have the weekend warriors that enjoy it. And then as the summer progresses, the kids go back to college, and then in August we get actually heat dehydration and other more serious problems as they do the football practices. And we really have to watch out for that in the August hours.
Excellent. So let's start first with the fact that we have to prevent injuries. So what would be some of the tips that people can use to avoid getting injured?
I think it's very important today. Somehow in our society we've figured out that everyone has to do one sport. And I think cross-training is one of the best things that we can encourage from our patients. And so it starts in the winter, where, you know, in the winter they can be on a bike inside, and I would encourage them to pick a sport or a series of sports that is fun. So whether it be, some people enjoy yoga and stretching, some Pilates, some people just like to go on the bike. I like to see them come out in the summertime, not having done nothing all winter, and now say they're ready for the summer. So if they're going to start in the summertime, I think it's important for runners to truly stretch. And it doesn't mean 2 seconds putting your hand on the wall, grabbing your ankle,
spend some time
and then
with it.
do it. You have to understand the muscles need time. And so the other thing is, going out, you want to go out slow. You want to warm those muscles up, and as you're starting to jog or around, or here we're in New York City, around Central Park if you're doing it, you want to allow the body to adapt. I think it's important to stay hydrated. Too many people say they get lightheaded, or they pop an Advil, which is not a good thing to do. They say they're going to pregame, and now that takes water out of the body, and now they're not ready. So I'd say the number one tip, first of all, is to stretch. You can stretch at home, take a towel, put it around your foot, really pull, and as you're stretching the hamstrings in the back of your thigh, that will help you tremendously. You don't want to bounce when doing stretching, touching your toes. You want to just grab for that and hold it to the count of 10. I think in the gym, indoors in the winter, some of those exercises with leg extension exercises are not the best because people will start to get kneecap problems.
How about when they get to exercise, that they go more gradually to it, and instead of just becoming, first-class athletes in one weekend?
Well, we are in New York, and everyone is a first-class athlete, and all kidding aside, in their own way, as they should be. But I think moderation is very important, and the difficulty that arises is that we don't know and we don't teach moderation. But if we can be smart about it, so if we're on a treadmill when we're running, if we do 20 minutes at a certain pace and then we go up 40 minutes at another pace, that's a great suggestion for most people.
But sometimes injury will occur, and when that happens, people are going to seek medical help. So what would be the difference between seeing, let's say, a general orthopedist versus seeing a sports medicine doc?
So there are many types of sports medicine physicians now today. There are those that, excuse me, are non-operative sports medicine doctors, and they're well trained and they get to see patients. There are family practitioners that are sports medicine trained too. But within the orthopedic realm, there are those of us that decided to do general orthopedics, and then we're required sometimes even to be board certified and sit for an exam that requires us to learn additional thoughts to sports medicine people. The general orthopedist is well trained to take care of a sports medicine person, but sometimes they may come at it with a different thought process, and they don't even know that they are sports medicine general orthopedists.
Right.
But if we're being very specific, there are exams that you have to take to become a sports medicine orthopedist. And
so it's a higher specialization.
Yeah, and in this practice, we've chosen to do that. We enjoy getting people back safely, but really pushing sometimes the envelope.
Very good. Now, when patients get an injury, especially, let's talk about different joints, for example, knee joint. What percentage would you say of a knee injury would need operation versus more conservative care?
I believe that every injury, unless it's something traumatic, which would be devastating when a patient comes in, should be given an attempt at conservative treatment.
I see.
While it's easy to say that, it's sometimes harder to treat someone in a conservative fashion. But I think we're learning with more what we call evidence-based medicine, that some of the things that we thought we had to operate on now, we don't. And there are times that you absolutely have to operate. For instance, we know for a young person, if they have an anterior cruciate ligament injury, that to truly pivot, to turn and twist, you're going to need to do operative intervention because the knee will give out. But then again, there are other types of injuries that we can have. We know that we used to think years ago that a ligament on the inside of the knee, the medial collateral ligament, needs an operation, but we know now it doesn't. We can brace it and get it better with a good physical therapist, with a good appropriate brace, and we can get them back on the field in no time.
So, talking about physical therapy, what is the importance of physical therapy, either in the non-operative and also in the operative cases that you see?
I think the most important thing for me and this practice in physical therapy is communication. And no different than we have to communicate with our patients, and we learn each day how to be better communicators. If you can't communicate with your physical therapist, then the relationship will not hold up.
Of course.
Both parties. The surgeon has to be available to accept the phone call or the interruption. The patient has to understand, even if it's not about them. The physical therapist must reach out. And so there's guidance on both ways because both sets of eyes are seeing something as we progress. So for non-operative physical therapy, I think it's important to know what modalities will help, and that I think slow and steady is the way to get the patient back. And often that if you come up with a program that's attentive and it's one-on-one, then we'll have success.
And this is, I'm sure you'll agree with me that I say many times in this program that in regards to the physical therapy component, there is what I call shake and bake physical therapy, where they put a patient on a bicycle and with a couple of modalities, and that's it about physical therapy, versus physical therapy that is one-on-one, very specific, evidence-based,
Right.
that has specific goals to reach and
I
follow
think
specific
it's
protocols.
no pun intended, but it's a hands-on process that's very important for the communication as well.
Absolutely.
I think in post-operative physical therapy, it's essential that a physical therapist cares what the surgeon found in the operating room. I find that they might even read the operative note to understand the subtleties. It's not just a prescription of physical therapy. We try to write specifically which muscles can be activated, which cannot. Can they be done actively, passively, active assisted? When do we do eccentric loading? When do we do proprioception, plyometric, all these different modalities? And there's a time for everything. And then suddenly the patient will see some great results. And it's a communication of those three parties that gets them excited, and then we get a great result.
Here is a question about the quality of life of a patient after whatever intervention he or she receives, whether it is operative, rehab intervention, or completely conservative intervention. What are the key factors that determine how much that patient will be able to return close to 100% to their daily activity level that they had before the injury occurred?
Philosophically, for us in this practice, the role of a surgeon is to try to return people and anatomically bring those parts back to the way they were. Sometimes we cannot do that, but other times I think if we intervene early, we can. And so it gets back to one of your earlier questions. I'm not a gatekeeper. Many times the internal medicine doctor, the family practitioner, the physical therapist sees the patient after an acute injury. And so I would implore that physical therapist, that internist, to maybe give for an opinion to that orthopedic surgeon or to that sports medicine doctor. Because if a repair needs to be done, for instance, on a meniscus, that small cartilage cushion between the thigh and the leg bone, something done sooner, if it needs done, can get a result close to 100% rather than the effects, I believe, than waiting. Now, others might feel otherwise because they say it will get better over time. But I have found through the years, over 20 years, that chronicity is the evil partner. And if we can deal with it in an acute fashion, sometimes with just good therapy, then they get back to doing the things, and then there's a positive attitude and things go well for the patient.
Thank you. And how about a couple of final tips for our viewers in terms of general prevention, even if you have to repeat some of what you said already?
So if I had to, everyone loves to go to the gym these days. So if we're doing the upper body, 3 tips for upper body workouts are: please keep your hands in your peripheral vision. If your hands aren't in your peripheral vision, whether you're doing triceps behind or you're doing any kind of abduction exercise, then you're putting stresses on the shoulder that you don't want the shoulder to come out of the joint. You want to do low weights, high reps. That's an important thing as well. Never do a military press. You never want to do that. You can substitute an incline press for a military press.
Okay.
If we were in the lower extremity and we were in the gym, I said I'd like you to avoid the leg extension exercises. It really doesn't help the kneecap, and we don't want any arthritis of the kneecap. I would say that there are so many new devices in a physical therapy world that they can actually bring you back to jogging by taking your weight off. There are machines that it's exciting, so you can get back in shape without your full weight being exercised when doing some post-operative care. And I would encourage you that have a positive attitude when getting out there, because there's nothing better than, it could be from the 85-year-old that just wants to walk around the park, and it could be into the 17-year-old who wants to be in the championship round of tennis. We can get you over those injuries. Don't avoid seeing an appropriate caretaker like a physician, an orthopedic surgeon, or a sports medicine doctor, so we can get you back out and playing and back in your game.
And finally, a couple of words about swimming that many people will be involved in.
So I did forget swimming, and I think swimming is terrific because it's a non-gravity sport. So there are fins that you can buy that fit to your feet that make you webbed, much
Right.
like our friendly fellow creatures that are webbed.
Right.
So you become efficient in the pool. And water therapy is fantastic to getting people
Absolutely.
rehabilitated.
Absolutely. Dr. Blanchard,
Thank
thank
you
you so
very
much for
much.
joining us today.
Thank you.
And this was Hands On News. I'm Dr. Kostopoulos, and I had the pleasure to meet with Dr. Blanchard today and discuss about the summer injuries. We'll be with you next week. Thank you.